Well, it's been more than a year of lockdowns and stay-at-home orders, but it's starting to feel like there might be a light at the end of the tunnel in the battle against COVID-19. More people are getting vaccinated, case counts have fallen sharply, and the province is talking about a slow reopening over the course of the summer. In fact, some people would like to see it happen faster. Well, Dr. Janet DeMille, Medical Officer of Health for the Thunder Bay District, joins us now for our weekly update. Good morning.
Good morning, Mary Jane.
So we've just come through another long weekend. Did you have any concerns about people getting a little too complacent about COVID and maybe flouting some of those public health guidelines?
Well, I'm always concerned about that because I know that could lead to the spread of COVID, or, one gathering, one activity could result in, an outbreak that has broader impacts for us. But at the same time, I'm really pleased at how, as communities, we've been able to manage and hold COVID-19 at bay here. And I think people are largely compliant, or certainly trying to be, so I really appreciate that.
Now, some people might be looking at the trends and thinking everything's going to be fine from here on in. How valid is that?
You know what? I think everything is getting better from here on in, but I think there's still a vulnerability that we have, that we will continue to have. This pandemic isn't over. I keep thinking about what the lead of the World Health Organization said. It's not over anywhere till it's over everywhere. And we certainly see parts of the world, especially where COVID is still, running rampant in different ways. And even in this country, or in the province, we still have, areas where there's higher COVID rates, and that will always sort of put us at risk. And so, there's always the possibility of an outbreak, or, spread, or a cluster of cases that could have significant impact. At the same time, though, as we, get closer to summer, where we know this virus, we did very well last summer, and as our immunization rate goes up, we're increasingly protected as a population and as communities, and that certainly bodes well for us overall.
And those vaccination rates still going well in the city, aren't they?
Yes, we're doing very well, and in the district and First Nation communities, everybody has there's so many people involved in this vaccine rollout, delivering immunizations, and many people, coming forward to get that vaccine, and that's really tremendous. And every time I look at the numbers, it's like, wow, we're doing well, and anticipate to sort of continue to see that, especially over the next month.
What are the numbers? Can you tell us?
So we always measure the numbers as of sort of the Saturday. So last Saturday, our numbers, which are actually admittedly likely a little bit of an underestimate, but we did 50% of the broader population in the Thunder Bay District Health Unit had received at least one dose, and we were close to 60% when we look at sort of the 16 plus population, so people over the age of 60. So that's really people over the age of 16, 60% had at least. And what we're also starting to see is increasing people that are fully immunized, that having had the 2 dose, which of course offers the optimal protection against this virus.
Now, yesterday, the provincial medical officer of health suggesting he'd like to see students back in classrooms soon. How do you feel about that?
I want to see students back in the classroom soon, too. Very much. I think with our COVID-19 numbers, with immunization that have been done, including of educational staff, and we're starting the rollout of 12 to 17-year-olds receiving vaccine, and with all the measures that schools have put in place and school boards over, with COVID, and how we saw those worked back in the fall and the winter. We closed schools because what we saw was schools, was the community was impacting the schools. But, at this point, I think it's, I think the harms of having students out of school on their mental, emotional, and developmental well-being are greater than the risks of COVID.
And what are you hearing from the province to this end in terms of schools?
I certainly appreciate Dr. Williams' support as the Chief Medical Officer of Health. I know there's advocates for, others, pediatricians, for example, and children's hospitals and mental health professionals all advocating for this. I certainly appreciate, though, and I've heard directly actually from the Premier that there are other constituents that they need to take into account, that they're maybe hearing other messaging, and that they need to make this decision. Recognize, and they might have to take into account different things that I would take into account. So, feeling like there's not a lot of clarity, although I do recognize and appreciate a lot of the support for reopening of schools.
Now, if the province is reluctant to send everyone back to class, next week because of infection rates in other areas, is it possible we could see a regional approach when it comes to schools?
So I'm not sure what the province is sort of considering. I'm aware that they were, from the public health side, looking at, what that would look like. And certainly in the northwestern Ontario, when we were considered as a region, it was recognized that we had some of the lowest rates in the province. But again, it is the cabinet and the Premier that makes that decision. And I have heard, the Premier not wanting a regional reopening, but, he seems willing to have those discussions and hear from different parties, and I'm hoping that decision will change.
Well, and I know that was part of what Dr. Williams was saying, that maybe it would need to be done or regionally, rather. It
is really hard to argue why schools are closed here, given the low numbers we've had and the fact that we've had low numbers for several weeks now, all our data is validating this. And now that, our partner in the Northwestern Health Unit has also seen a decline in their cases, it's really hard to argue that the schools should still remain closed.
Now, the province released its new reopening plan based largely on vaccination rates. The stage 2 threshold, 70% of the population receiving their first dose, 20% receiving their second. Based on what you're hearing, how quickly do you think the province could get to that stage 2 threshold?
I think we're almost there. The province has a goal by the end of May to reach 65% across the province. And last I heard, which was in the last couple of days, is we are definitely going to meet that at the provincial level. So that's 65% of adults. And so we're already, and I think that if roughly, I sort of think the number goes up by 5% every week. So we'll be there faster than what's laid out in that plan.
So if we're already getting close to the stage 2 threshold, do you suspect it would be much longer before we're even talking stage 3?
You know what? I do have a lot of questions about that reopening and the timing of the reopening. And I noted in their news release they talk about safely and cautiously opening up Ontario, and that's certainly how it comes across. I think it'll be interesting to see what they do when we actually meet those targets earlier than they had anticipated, whether they would move into those stages earlier rather than hold back. But I think they're considering a lot of different factors, and I appreciate that they did change some of the outdoor opportunities that people had before the long weekend. That sort of came, it was a welcome change, but came, we didn't really have much advanced warning on that. And certainly hoping that we have more advanced warning, but hoping that we can move through those stages faster than the way it's laid out.
Mm-hmm. Now, obviously, people are talking, they feel we should be able to reopen faster because, as you've said, our case count is low in this district. How likely is it that the region could get some autonomy over reopening? It feels like it's a bit of a black box in terms of those decisions, and I certainly advocate
where I have opportunity to consider reopening, the regional approach, and we can share, I share our numbers, not that they don't already have it, but I can certainly share my thoughts and opinions. But we're also seeing, the numbers overall going down in Ontario. Mostly, I think, what concerns them, of course, and concerns me, even though, is that as we talked about earlier, Mary Jean, we're still not completely out of the woods. The pandemic still is around us. So when you look at what's happening, for example, in the Timmins area in northeastern Ontario or in Manitoba, you could see that, there's still a vulnerability that we have. So I do appreciate that needs to be considered. But at the same time, our immunization rates and our low case numbers put us at a very good position right now. And I think a gradual, reopening, perhaps, faster than what they've laid out, would be very reasonable for us.
Mm-hmm. Now, we know a small percentage of people who are vaccinated can still catch COVID-19. Some of them may not show symptoms. That could potentially make it hard for people who are still medically vulnerable to the virus to, kind of judge their safety in public places. As we move toward reopening, are there plans to do any kind of surveillance testing in the population to understand just how prevalent the virus may still be in the community?
I think that is a really important thing as we move forward, especially when we start to get into the fall and the winter season, where we know this virus is more likely to circulate, right? And certainly needing to monitor for changes, new variants that might appear, and monitoring the impact. So I do expect that there will be a number of surveillance measures. Some of them, the ones that we already have in place, but more enhanced measures. And you see the rollout, for example, of more testing in workplaces. Those rapid tests are not necessarily as accurate as the full-on, what we call the PCR test, but that will help monitor. I do anticipate that we'll still have very good access to the gold standard test, which of course the assessment center here in Thunder Bay does, and that could be rolled out further to make sure we're taking advantage of that. And even some novel, technologies I think are explored, sort of like wastewater testing, right? And being able to monitor that. The City of Thunder Bay has been involved in a research study around that, and I think that presents real opportunities as well, so that, if people maybe aren't getting tested the way we want them to, but if we can monitor it in other ways, I think that would be very important.
Listen, as usual, I really appreciate you taking time out to speak with us this morning.
Thank you very much, Mary Jean.
Bye-bye.
Bye-bye.
Dr. Janet DeMille, Medical Officer of Health for the Thunder Bay District. She joins us nearly every Thursday on Superior Morning. If you have questions you'd like us to ask her the next time she is here, drop us a line at thunderbay@cbc.ca.